It was a struggle because the medications we prescribe are very expensive and there's a high overhead cost to running a pharmacy.
We were so resource constrained that we weren't doing for the community what we needed to.
Whitman Walker Health is a federally qualified health center focused on serving the LGBTQ community in Washington, D.C. It's been in business for 50 years and takes care of 20,000 patients. About 20 years ago, the unique needs of its clientele made it clear that Whitman Walker needed its own in-house pharmacy.
Hey Grayson, how's it going? Hey, nice to meet you.
Because of our history in serving people in the LGBT community and people living with HIV, access to medication was really important.
An enormous amount of the care management we do has to do with medication management. And so having a close working relationship with the pharmacy is invaluable.
Whitman Walker tried to create its own pharmacy, but it soon became clear that they didn't have the resources to go it alone, so they looked for help.
We really needed an organization that was willing to invest the capital in us up front, because at that time, we weren't positioned to purchase the medications and make sure the shelves were stocked. We needed someone who was going to be a good business partner with us to do that.
So in 2008, we came in as a consultant, helped them with some purchasing needs, quite frankly, helped them with some facility needs. It was less than a desirable facility that they had here, physical facility. We helped them understand what this pharmacy could be.
Maxor realized that for Whitman Walker to thrive, it had to do more than fill prescriptions.
And this really had to become a destination for the community to want to come here and have their problems solved and feel safe.
So do we want to make sure I stay on the same hormone level that I'm at?
For Whitman Walker, the Maxor-run pharmacy has become more than a business tool. It's become a critical part of patient care.
The pharmacy itself is a really high-volume enterprise that is integrated fully with the clinic staff. So they have access to the electronic medical records. They have ready access to providers if there are questions about prescriptions. They view us as a resource.
Not only can I communicate very easily with the pharmacist in terms of assuring that my patients pick up their prescriptions and get what I prescribed or answer questions, they also can provide me with real-time adherence support.
So what we can do is put in your refills.
Has this patient missed picking up their prescriptions? Do I need to reach out to them and proactively re-engage them? And so it's amazing.
Well, I think the Maxor team are actually folks who are very well aligned with our overall mission. They understand what it's like to work at a federally qualified healthcare center, the different challenges.
We create an environment that people can thrive at. People want to come to work here. They believe in the mission.
And they're dedicated to the patient's care. They're not just filling prescriptions and charging administrative fees. They're actually part of a team that is dedicated to helping people live healthier lives.
Helping people. It's always been my passion. We have a very close, integrated relationship with the providers, with the nurses, with the medical assistants.
I've never had a relationship with a pharmacist like the ones that I have here now.
Really, they're passionate about providing care to this population. That's what we're looking for. We specifically seek that in our pharmacists.
And that dedication is not lost on Whitman Walker patients.
Because the pharmacy staff, they welcome me with open arms. They're loving, they're supportive. They're like family. You know, they treat you special. Put it like that, they treat you special.
Maxor has been incredible at helping to embrace our mission and really helping to make sure that the staff in their pharmacies represent us. They represent our patients, they represent our mission.
And the people in our pharmacy look like the people who get care from us, and vice versa, and that's really important to who we are.
Because all of the employees that are working in the pharmacies are branded as the client. They work for Maxor, but the junkie public that walks in off the street isn't going to know that. They're going to say, oh, that's my Whitman Walker pharmacist. That's my Whitman Walker patient care coordinator. That's the person that calls me every month and reminds me that I need to come in or asks if I want delivery.
The devotion of the Maxor pharmacists is a source of comfort for Whitman Walker patients.
That warmth that you just don't get from any other pharmacy. You can just drop in and talk with them. You don't need to pick up anything. They're always welcome with a smile, warm heart, and everything. They're wonderful people.
Lots of folks will establish a rapport with our pharmacists, and will often tell them things that maybe they didn't report during their visit.
The ease patients feel at the Maxor pharmacy contributes to better care.
If they have a poor interaction with a pharmacist, then that will affect their overall health outcome. And I know that when they go to our pharmacy, they're going to get a little more TLC than they might get elsewhere, and that makes a huge difference in having people stay in care.
The depth of Maxor's commitments revealed itself when COVID struck.
It was a very scary time. The one thing we knew for sure was that it was going to be very dangerous for most of our patients. Most of our patients are immunocompromised. Most of our patients are persons living with HIV. So we knew that we had to take somewhat extreme steps to protect our patients and also to protect ourselves so that we could continue to run the business.
Very quickly, almost over a weekend, and that is no exaggeration, we had to reinvent the business model.
We literally shut down the pharmacy lobby and retooled that pharmacy to make it completely mail order. So we were doing home delivery for every prescription except for those patients without homes. We would do curbside delivery for those folks.
The staff did not miss a beat. We did not let the community down. We continued to service their needs.
Several of the nurses and several of the providers actually said, "Ooh," I'm tearing up a little bit, that we kept our patients alive during that time.
It's not easy providing the care we provide, and especially during the COVID pandemic, to be open and operational through that together, that's really, it just strengthened our relationship.
I've always looked for a position where I could practice pharmacy in a way that made me feel proud and that would make my mentors proud of me. And I feel proud every day I walk through the doors of Whitman Walker Clinic.
When I think about the contributions that the pharmacy makes to our business, the first thing that I really think about is how many prescriptions are we filling? And not because of the volume of revenue that might provide, but it's the volume of care we're delivering. It is part of care, and that's really, really important to us. It's important to the communities we serve. And because of our unique expertise and our commitment to the people that we take care of, having people get their meds from us matters.
For me, it always comes down to patient care. I think the patient care we provide with Maxor as our pharmacy partner is better than the care we were providing previously. But, you know, if you talk to our CEO or CFO, I'm sure they would also mention that the financial stability and revenue that the pharmacy generates has been incredibly important for being able to provide all the services that we do.
Have a good day. Okay.
I have had calls from colleagues asking me about our program and who to recommend. And I would recommend and have Maxor because it's a partnership. The bottom line matters, all the financing matters. But if you're not committed to the patients that we take care of, we're mission-based organizations at the end of the day. We're not here to make money. We are here to stay open, but it won't work if we're not aligned around care.